IUD stands for intrauterine device. It's a tiny T-shaped device that a doctor inserts into your uterus to prevent pregnancy. The IUD is ideal for long-term birth control, but getting it inserted and removed can be uncomfortable. Just remember, IUDs don't protect against sexually transmitted diseases. Here's what else I tell my patients about getting an IUD. IUDs can last 3 to 12 years, depending on the type, and they're more than 99% effective. You can't really mess them up by forgetting to take a daily pill. There are 2 types of IUDs, hormonal and non-hormonal. Hormonal IUDs contain the hormone progestin. This thickens cervical mucus and makes it harder for sperm to enter the uterus and fertilize the egg. It also thins the lining of the uterus, making it harder for a fertilized egg to attach and may even prevent ovulation in the first place. There are a few different kinds of hormonal IUDs. They vary in the amounts of hormones they contain, their size, and how long they last. They range from 3 to 6 years. The non-hormonal IUD contains a small amount of copper, which creates a toxic environment for sperm in your uterus, so it can't swim to an egg. The copper IUD lasts for up to 12 years. Want to get pregnant? You'll be fertile again as soon as you get the IUD removed. An IUD can affect your period, for better or worse. Hormonal IUDs can soothe period cramps and make your periods way lighter. Some women can even skip their periods altogether. On the other hand, a copper IUD can make your period worse. Cramps and bleeding may increase for the first few months, but side effects usually subside within a year. You'll still get a monthly period with the copper IUD. Insertion isn't a picnic, but the pain varies. Most women say it feels a little crampy, like getting a pap smear. How much it hurts depends on your own pain tolerance. Sometimes women who've already had kids report it's less painful than women who haven't. The whole process generally lasts less than 10 minutes, and I tell my patients to take ibuprofen before the visit. You can still use tampons with an IUD. An IUD lives in your uterus with a little string that hangs out in your vagina to help your doctor remove it. Tampons go in your vagina. You should be able to insert and remove them without affecting your IUD. Serious complications are rare, but you should talk to your doctor about them. IUDs can sometimes slip out of your uterus, which means you're no longer protected from pregnancy. IUDs can perforate the wall of the uterus, but this is exceedingly rare. There's also a slight increased risk of infections like pelvic inflammatory disease. So, to recap, IUDs are 99% effective at preventing pregnancy. IUDs work for 3 to 12 years, depending on the type. IUDs need to be inserted by your doctor, and IUDs don't protect you from sexually transmitted diseases.